I'd like to introduce Deana from the United States, who takes LDN for multiple sclerosis. Thank you for joining me today.
Oh, you're very welcome.
And happy birthday. I won't sing because I'm a terrible singer. Could you tell us when you first started to notice your MS symptoms?
Well, I noticed my MS symptoms probably back in 1995, maybe before that. I had my second child, and I was having a lot of back pain and different things like that, and then I was tripping a lot. And that's about when I started noticing some things, and I was misdiagnosed for quite a few years.
What were you diagnosed with originally?
Well, I went to a few different doctors. They thought I had lupus. I don't even remember what else they said, but it was so totally off the wall. And I kept changing doctors because then it would go away, whatever was happening, and I can't remember exactly. My long-term memory's kind of bad from back then, but I can't remember exact things that happened that made me think when I first was diagnosed that, oh yeah, that was that. You know? And then in 1999, I was a certified nurse's assistant, and I hurt my back then. And I don't know if I'm going to go into your next question with what I'm going to say. So
you're fine.
I thought I had slipped a disc in my back. And I asked the doctor to do an MRI of my back because it was bothering me for months after I did it. And they did an MRI of my back, and she saw sclerosis. I thought she said scoliosis. And then she wanted me to go for a brain MRI, and I'm like, for my back? Okay. So I went for the brain MRI, and they found a whole bunch of lesions on my brain. And then she called me at work to notify me that I had multiple sclerosis. It was the same day. It was August 20th, 1999, the same day Montel Williams found out he had it.
Oh.
Because I went home and I saw it on TV that he found out he had it that day.
Wow. And what would you say your quality of life was at that time?
At that time, I was having issues driving to work. I was falling asleep while I was driving to work. My job was about a half hour away from my house. I was having a lot of fatigue. And I was tripping. I had switched jobs. I was working at a nursing home, and I had changed jobs and became the scheduler for the nurses and the aides of the nursing home. And I wasn't an aide anymore because after I hurt my back, I didn't want to hurt any of my patients. So I'm like, this might not be a good idea for me to do that anymore. So I applied for the scheduling position. And I did that for a little while. I had gone on to Avenex, and I would take it on Friday when I got home. I would be sick all weekend long. And I'd go to work on Monday and work all week long and do it again on Friday and start all over again. And then I just was so sick. And then I had a observation where I had optic neuritis. And at that time, I went out of work and I went on disability because medicine was making me so sick. And there was short-term disability. I tried getting Social Security disability, but when I was just diagnosed, me and my husband had just moved into our first house we had built, and I didn't want us to lose our house with me being out of work, so I said, I got to go back to work. So I stopped filing the claim for disability, and I got a job that was closer to home. And I did that job for about 6 months, and then I got laid off.
Oh.
But I got my husband in there before I left. And he's been there since then. So that's good. So I was out of work for a while with that, and then I got a job a little bit farther away because there was nothing closer with the visiting nurse service, scheduling nurses there. And I was okay for a while. I would have exacerbations, but if I could get to work, if I could drive, I went. There were times where I had to wear an eye patch to have one of my eyes covered up, but I still went. And there were times with my legs where I had problems. I was stubborn. My nurses would give me my IVs for Solumeto steroids at my desk so I could be there because they wanted me to be there. But I did that for 13 years, and I just left there in 2013, very beginning of 2013, because my husband's job that I got him into, the factory, we lived in New York, upstate New York, near Lake Ontario. They closed the factory down there, and they offered him a position in New Hampshire, in New England. So we took the position with the plan of me not working again. And I was home, and I thought I was doing good, and I wanted to work because I was going crazy being at home and not doing anything and not knowing, being in a strange place and not knowing anybody. So I started looking for a job, and I worked full-time. I had an exacerbation I had other exacerbations in between my time when I was at the visiting nurse service. But I had a bad one right when we were starting to move here, when I was trying to work full-time plus move me and my husband to New Hampshire. At the same time, I think the stress of everything threw me into my MS attack. And I had a bad one then. And then we got here in March, and I was good for a while not working, not having the stress of looking for a job or working. And then when I decided I wanted to work and I was trying to apply for jobs again, it threw me into the worst exacerbation that I had in this past November. So I wasn't working then. And the nurse that came to give me my IVs at home, I had to have IVs for 5 days, which is the longest that I ever had to have them. And I still didn't think everything was going to come back, but luckily it did. I still have a little bit of problem with my speech sometimes, as you can tell. I jumble my words a little bit. But she was the one. I asked her I found a neurologist because I didn't have one yet, and I had to find one right away. And he wanted to put me on Tecfidera. But I found out when I was on Tysabri and then I was on Gilenya that if you have the JC virus, which I do have, you shouldn't be on any immune-suppressing drugs at all. And apparently my doctor in New York didn't know that and put me on Gilenya anyhow. But she took me off of it once I told her I didn't think I should be on it anymore. And that's why I started having the attacks again, because my MS was so bad at that. It had gone from relapsing, remitting to secondary progressive. Probably in like 2010. They said I had to be on something or I would be in a wheelchair in 6 months. And that's when I went back on the drugs, because I had come off of the Avonex after being on it for 4 years in 1999. So 99, 2001. So 2002, I went off of the Avonex. I tried Copaxone, and I had an allergic reaction to that. And then I just didn't go on anything. I'm like, I'm okay. I don't have to be on anything. And so then I was on nothing when we were doing the move to New Hampshire. And that's why I was having these attacks. And I had such a bad exacerbation in November where I lost the feeling on half of my head down to my throat. I couldn't feel anything. And I almost choked to death when my husband was at work because I aspirated when I was drinking. And this nurse that was coming to give me the IVs, I said, do you know of any other medicines that are out there? I said, do you have other MS patients you go to give IVs to? And she said, yeah, let me look into it and I'll let you know. And about a week later, she sent me a message and said, have you heard of Low Dose Naltrexone? You should look into it. I have a patient that says she's having a lot of luck with it and doing really good. So I looked into it. I did a bunch of research, and I asked my new neurologist if he would put me on it, and he said no, because he didn't specialize in MS, and he'll only give me the medicines that are approved by the FDA for MS. And then I went to my new primary physician that I got, and she's like, no, I never heard of it. I can't put you on something I've never heard of. So then I was in a conundrum. Then I had to call the compounding pharmacies, and I was asking them what doctors they knew that were filling the prescriptions that I could possibly become a patient of theirs to get the medicine. Mm-hmm. And in the beginning, most of them weren't accepting new patients. And then I was having a hard time finding somebody near me. And finally, I did find somebody. Her name's Diane Hunt, and she's with Humane Vitae in New Hampshire. She's wonderful. So I switched, and I made her my new primary doctor. And she uses LDN for fertility treatments. That's her big thing she used it for. So but she's getting into giving it to people for other things. She gave it to some patients that had cancer, she said, mm-hmm. that the cancer's in remission now, and they're doing fine. I was her first patient with MS that she's giving it to. So I'm trying things that I'm seeing people saying online, like dosage-wise, because she put me on 4.5 milligrams right away. And then I was having really bad headaches. In the beginning, I said, and I pretty much did it myself. I cut back to 3 milligrams to see how that was, and that was great. It worked wonderful. I didn't have any headaches, and I felt fantastic. After 2 days after being on it, I thought I was getting restless leg syndrome because every night my legs hurt so bad. I felt like I had to stretch, and I was having such bad pain in my legs. After the second day, I was sitting watching TV, and I'm like, you know what? My legs don't hurt at all. I have no pain in my legs at all. I couldn't believe it. And I wasn't even thinking about it, but I'm like, wow, I feel great. And this was only being on it like 2 or 3 days. I felt wonderful. And now I'm back up to 4.5 milligrams again. I built myself back up to it, and I seem to be doing really good on it now.
Well, that's fantastic. What would you say to other people who've been diagnosed with MS?
That are diagnosed with MS?
Yeah.
I think you should start it right away. If I had known about this back then, all that I went through being on these biological drugs and all the side effects and the bad things that I think about, all these poisons that I put into my body. And then I wonder what's going to happen because of that in the future. And I actually spoke to a pharmacist down in Florida. I emailed with him because I'm trying to get my father to go on it for his cancer. And he lives down in Florida, and I was asking him some questions. And I said, I'm kind of hoping that being on this will prevent me from getting cancer because my father has cancer, and my mother died of lung cancer, and she never smoked. And he said that is the reason why I'm taking it. He doesn't have any reason he's taking it for other than not getting cancer. Mm-hmm. And I would say to anybody with MS, you should try to find a doctor right away that will put you on this so you don't have to be on the other drugs. I don't know. It changed my life. I'm back working again now. I got a part-time job. I'm going to the gym 3 times a week. I feel wonderful. I've climbed 4 mountains since we've been to New England with my husband, and it was wonderful. It really changed my life. It really did. And I'm telling all my friends and everything about it that have Crohn's or fibromyalgia or cancer or anything, and MS, all of my friends with MS that I know, I told them, I said, you have to look into getting on this medicine. It's fantastic.
Oh, what can I say to that? What an amazing story. Thank you very much for sharing it with us.
You're welcome.